Hi, I'm Juliana Laikan Ashaw from BSN 2B Group 1. Today, I will demonstrate the procedure, placental examination. So for the assessment, the placenta is a fetal organ of pregnancy that is responsible for the nutrition and oxygen to the fetus as well as the excretory functions. A 1-minute examination of the placenta performed in the delivery room provides information that may be important to the care of both mother and infant. The findings of this assessment should be documented in the delivery records. During the examination, the size, shape, consistency, and the completeness of the placenta should be determined, and also the presence of accessory lobes, placental infarcts, hemorrhage, tumors, nodules should be noted. The umbilical cord should be assessed for the length, insertion, number of vessels, thrombosis, knots, and the presence of Wharton's jelly. Also, the color, luster, and odor of the fetal membranes should be evaluated, and the membranes should be examined for the presence of large filamentous vessels. So next is for the planning. The equipment that I will use is flashlight or pen light, gloves, basin or bowl, syringe with needle, washable surface to lay the placenta or large tray, weighing machine, measuring tape, and kidney tray. Before proceeding to the procedure itself, I will define what is placental examination. So, placental examination provides valuable information about the care of both mother and the infant, such as the effect of the maternal abnormalities or the placenta on the placenta or the cause of the preterm delivery. The maternal surface of the placenta should appear dark maroon in color and should consist of around 20 cotyledons. The structure should appear complete with no missing cotyledons. The fetal surface of the placenta should be shiny, gray, translucent enough that the color of the underlying maroon villus tissue may be seen. What are the purposes of the placental examination? So, its purposes are to ensure that the entire placenta and membranes have been expelled and no part has been retained. Also, to make sure that the placenta is of normal size, shape, consistency, and weight. And then, to detect abnormalities such as infarctions, calcification, and other additional lobes. To detect the length of the cord, number of blood vessels, and site of the insertion of the cord. And lastly, to check the weight of the placenta and measure length of the cord. What are the different placental interpretation? So, for the placental size, placenta less than 2.5 thick are associated with intrauterine growth, retardation of the fetus. For the placenta that is more than 4 cm thick is associated with maternal diabetes mellitus. And the placental consistency and surfaces, pallor of the maternal surface indicates the preterm of fetal anemia, which may be a sign of hemorrhage. A thickening membranes on the fetal surface may represent a circumvillous placenta associated with prematurity. So for the umbilical cord, while opinions of authorities differ with regard to the limits of normal cord length, which is 40 to 70 cm, would appear as the reasonable range. Short cords may result in cord rupture, hemorrhage, and structure. The umbilical cord may be excessively long because of the fetal hyperkinesis. For the cord vessels, the umbilical cord contains 2 arteries and 1 single vein. If only 1 artery and 1 vein are present, the fetal anomaly rate is nearly 50%. Lastly, the free fetal membranes. It should be thin, gray, and glistening. Thick, dull, discolored, or foul-smelling membranes indicate the possibility of infection. So, for the procedure, first is I will explain the procedure to the parents. So, ma'am, ngayon po, magsasagawa po ako ng placental examination. So, importante po ito para po malaman natin kung may mga abnormalities po ba ang placenta. And the next is I will wear an apron and then gloves. So, the rationale of this is to prevent our uniform from getting soiled. And then wear gloves. Next is I will ensure that there is an adequate lighting to check the placenta. And then I will prepare a flat surface with protection to avoid blood spillage. And then next is I will prepare a syringe and needle for the cord sample. And then I will now lay the placenta, fetal side uppermost, and then I will note the size, the shape, the smell, and then the color. And then I will examine the cord, and then I will note the length, the insertion point, and the presence of the through knot or thrombine. Again, the normal length of the cord is 40 to 70 centimeter. Next is I will inspect the umbilical cord vessels at the cut end and the furthest point of the placenta. So I will check if there is an artery and a vein. Then I will observe the fetal side for any irregularities. And then I will lift the placenta up the cord and observe for the membrane's completeness. Okay, I will check the cotyledons, so it should be 18 to 20 in total. But we should remember that during examination, we can literally count the number of cotyledons, so we can only estimate. And then I will return the placenta to the surface and spread out the membranes to look for extra vessels, lobes, or holes in the surface. And then I will separate the amnion from the chorion by pulling the amnion back over the base of the umbilical cord to ensure both are present. And then I will turn the placenta over to inspect the maternal surface. Again, I will examine the cotyledons, ensuring that all are present, noting the size and any areas of infarction, blood clots, or calcification. So I can see that it has an enough amount of cotyledons. And then I will retain the clot to make an accurate assessment of the blood loss. Next is I will observe that the lobes of a complete placenta fit neatly together without any gaps, with the edges forming a uniform circle. Where there is suspicion that the placenta and/or membrane are incomplete, they should be kept for further inspection and referred to the duty obstetrician. And then I will now inform the mother of my findings. So, ma'am, upon my examination, of the placenta, normal naman po, and I don't see any abnormalities. And then I will complete documentation, the woman's health and care record. And then after that, again, document all the findings, do the aftercare of the equipments that I use. That would be all. Thank you.